Good morning, everyone, and happy Tuesday. I am back this week to talk about Antibiotic Awareness Week because there's some pretty unsettling statistics that I found about Canada specifically, but I wanted to let you know what I found. So most of us know that antibiotics are typically given to treat pretty much everything. Any basic cold or flu, any common bacteria infections, viral infections, you get antibiotics. The problem is that if you prescribe them too often, that it builds resistant bacteria. Because the more that they are exposed to the antibiotics, they have an immune system not identical to ours, but they have the part where they can learn if they've seen something before, they can respond more quickly to it, and then the antibiotics don't work, which is what we call superbugs. And because of the overuse of antibiotics, they can no longer be used to treat colds, flus, or common bacterial infections. You actually don't need antibiotics to treat that. You really just need rest. There are lots of homeopathics that help with that as well. But it was found that Canadian doctors, this is for humans, prescribe 33% more antibiotics than Sweden and Germany. And there was a category of countries, but prescribes 33% more than the entire category of countries. And 3 out of 5 prescriptions for antibiotics have been given for an inappropriate use, meaning for colds, flus, or common bacterial infections. Now, antibiotics also kill some of the healthy bacteria. So we know that over 70% of a dog and cat's immune system is in their intestines, and the more antibiotics that they're given, the more good bacteria in that area are going to be killed. Not to mention it has a bunch of other side effects, like a depressed immune system at the time. It interacts with a lot of other medications. So if your animal's on antibiotics, there's a lot of other things they can't take. And the problem with superbugs and bacteria resistance is that it's actually passed into the water, into the soil, through families, communities, and even in hospitals. So especially if, for example, if one hospital was really known for prescribing antibiotics, and all of a sudden they started developing superbugs, it would pass through the hospital very quickly, and all of the patients and staff would start to have to fight off the superbug, but likely they'd also be prescribed antibiotics for that. Because of the overuse of antibiotics, pneumonia and gonorrhea can no longer be treated with antibiotics because there are now superbug strains of both, and antibiotics don't touch them. It also makes routine operations more risky. So things like hip replacements, appendectomies, C-sections, they're all more risky because they're typically prescribed antibiotics after to make sure there's no infection, but because there needs to be so many more strains of antibiotics now for the specific bacteria, that they become more risky because they have a higher risk of infection. It was also found, unfortunately, that over 10,000 illnesses a year in Canada, this is for humans, were due to resistant bacteria. So because of the overuse of antibiotics, we're actually creating more sick people and not less sick people. So if you have any questions, feel free to send me a message or ask your doctor or your vet. I find I just switched to a holistic vet, and Kai just went for a regular checkup. She rarely goes in with an actual issue. She has once or twice had parasites, but I give her the homeopathic dewormer for that, and then she's fine. But Kaya has never had antibiotics before, and she's almost 4.5. And I'm happy to say that after her spay surgery, we used colloidal silver on the wound to help it heal a little bit faster, and it is actually a natural antibiotic. So because she's never had formal antibiotics, I'm hoping she'll never get a superbug or anything like that. I know canine influenza, they were having a hard time treating that as well. But if you have any questions, you know what to do. If you're ever questioning when someone prescribes you or your pet antibiotics, feel free to ask them what strain it is, why they're prescribing antibiotics, because you have a right to ask these things. That's all I wanted to say. I hope you have a fabulous rest of your week. And I know there's an Instagram live on Thursday or Friday. I'm setting up to teach my advanced Reiki training master level this weekend. It'll be Friday, Saturday, Sunday. So if I'm off the grid for a couple of days, that's why. I'm really excited. It's going to be a lot of fun. And I've already had requests to teach again in the spring. So if you're interested in that, feel free to send me a message. I'm really excited. There's also the small animal clinic in February. There's only 2 spots left, and maybe only 1. And the horse clinic is in April. If you want to know more about that, feel free to check out my website. Have a great rest of your week, and I will see you later.